Hi, today I'll be talking about Truncus Arteriosus. So Truncus Arteriosus developmentally in a fetal heart is actually a ridge here that will later spiralize, and with the formation of aortopulmonary septum, it will divide into pulmonary artery and aorta. So in a normal heart view, normal simple diagram of a normal heart, so you will have 4 chambers, and from these 4 chambers, from the right side and the left side, on the right side, the right atrium, right ventricle, and the pulmonary artery will arise from the right ventricle, and the circulation will go into the lungs, carry the deoxygenated blood. And on the left side, the aorta will derive from the aorta will derive from the left ventricle and will carry the oxygenated blood to the systemic circulation, to the body. So this is what a normal heart looks like. But in Truncus Arteriosus, there is a failure of septation that occurs. Aortopulmonary septation. That means that the two vessels fails to divide. Thus, it will have one common vessels. So you will have just one common vessel that will have a mixing of blood of deoxygenated and oxygenated blood. So Truncus Arteriosus, what caused Truncus Arteriosus is unknown, but it is commonly found in DeGeorge syndrome. So what happened normally is the deoxygenated blood from the right side of the body, from the right side will go into the right atrium, into the right ventricle, and into the pulmonary artery to the lungs, where it will get oxygenated and enters the left side circulation, left atrium, left ventricle, and will be distributed through the aorta to the systemic circulation. However, in Truncus Arteriosus, there will be a mixing of blood, of deoxygenated blood from the right side and also oxygenated blood from the left side into the main circulation before it is mainly distributed. So as we know that this systemic circulation is higher compared to the pulmonary circulation. So because of that, more here there is a lower pressure compared to the left side. So due to the lower PVR, vascular resistance, there will be a higher volume of blood going to the right side. So because of that, because of the high volume of blood going to the right side, this will cause heart failure. As for the left side, because of the mixture of oxygenated and deoxygenated blood, that this blood will be redistributed to the whole body. You will get a mixed blood. Thus, this will explain the cyanosis. So what are the presentation of patient with Truncus Arteriosus? Patient usually presented with cyanosis during the neonatal period. So they can also present with heart failure symptoms, but this usually present during the 2 to 3 weeks of life due to the initial phase of high vascular resistance on the pulmonary system. So when the pulmonary vascular resistance finally coming down over 2 to 3 weeks, then only the appearance and symptoms of heart failure will show. So on examination, what will you find in this patient? First, you look for the of course cyanosis, the signs of heart failure. For example, from the general examination, such as tachycardia and the effort of breathing, whether in respiratory distress. And then on examination of the cardiovascular system, then you listen for the any presence of murmur, systolic murmur, and also the single second heart sound. And also hepatomegaly as a sign of heart failure. So what is the main treatment of Truncus arteriosus? The definitive treatment for Truncus arteriosus is of course surgical repair, where the aim of the repair is to separate the pulmonary artery and aorta into two main trunk, so that there will be no mixture of the oxygenated and deoxygenated blood.